My name is Vivien Chukwurah, and we're going to be talking about blood pressure, and I'll be teaching you guys more about blood pressure. For those of you that don't understand what blood pressure is, I'm going to do a review with you guys so you can understand what blood pressure is. Today we're going to be talking about blood pressure and what is blood pressure. Do you guys know what blood pressure is?
Yes.
Okay. Well, let me go ahead and explain it again. What blood pressure is: blood pressure measures the force applied to the artery wall as the heart pumps blood through the body. It's measured in two numbers, and it's the systolic number and the diastolic number. Systolic number, this is the first number in the blood pressure reading. It shows the pressure when the heart contracts and pumps blood into the body. And the diastolic number, this is the second number in the blood pressure. It shows the pressure when the heart rests in between heartbeats. So these are two numbers that we need to look at, and they have ranges for them. For the systolic number, the range is less than 120, and the diastolic number, the range is less than 80. So we always recommend that your numbers range around those two, less than 120 over 80. Also, we're going to be talking what is the purpose of having a low blood pressure, and how does high blood pressure affect your health. High blood pressure, which is also called hypertension, makes the heart work harder. Over time, it messes up the blood vessel that carries blood through the body. And if you don't control it, this can lead to heart attack, it can lead to stroke and other diseases. So we want to make sure we're taking care of ourselves. We want to make sure we're on the right track with our readings, our health, and ways we can control ourselves from having high blood pressure. One is to have a very active health lifestyle. Meaning, 30 minutes of exercise in a day would help you out. It will take you through a long way. Diet-wise, control your diet by limiting your intake of salt and sodium. So what we're going to do, I'm going to actually demonstrate to you how we take blood pressure and what is required when you're doing it. First of all, you want to make sure that you're using the right cuff for your patient, because if it's too big, it will not read right. If it's too small, it will not read right. So this is the perfect cuff for his arm. And then you want to have your patient pull out. You want to have your patient pull out their arm, and we're looking at a brachial artery. That is where we're going to be taking the blood pressure. This is an automatic machine. If we're doing a manual, we'll be using the stethoscope, but today we're not going to be using the stethoscope. And we're going to take it, and we'll see.
Mommy.
And this is going to record his systolic and diastolic number and the blood pressure.
Mommy.
Okay, so looking at this number, we have a systolic number of 148 and a diastolic number of 92. With this patient, we'll talk to him about, limiting intake of sodium. Ask him if he's taking any blood pressure medications. And if he's not, we want to make sure he has a low sodium diet, he's exercising, and he's keeping a healthy lifestyle. That's all for today. Again, join us next time if you want to understand more about blood pressure.
Thank you.